roll back the federal policies risk reversing hard-won progress and make care more accessible and affordable. And for many Californians, that accessibility and affordability was already in question. More than half of Californians are worried about out-of-pocket expenses, long-term care, and monthly premiums, concerns that now surpass anxiety about housing, groceries, transportation, or utilities. Nearly 6 in 10 Californians report skipping or postponing care in the past year because of cost, and 4 in 10 of them say their condition worsened as a result. This is what uncertainty looks like on the ground, and ongoing federal instability compounds existing financial stress.
And as a healthcare provider, I know that health coverage is foundational, but we still need to do more to ensure that access for all is appropriate, timely, and affordable, to ensure the best healthcare outcome for all Californians, regardless of their zip code. And this is why it is so very frustrating in this moment that under this federal administration, that we are going backwards in terms of our access instead of forward.
We're here today because we're at a critical turning point in healthcare coverage in California. As Chair Bonta remarked, for 2 decades, our state has led the nation in expanding healthcare coverage, achieving historic lows of uninsured rates of even as low as 5.9% in 2024. However, all of this progress is now under immediate threat from federal policy shifts with the expiration of vital subsidies, as well as threats to our workforce, as well as our hospital systems.
When healthcare costs more, employers pay less. And then those low-wage employers don't provide healthcare at all. And that means that the California taxpayers are the ones who have to shoulder the burden. And we know early research is showing that 20% of employers in this state rely on Medi-Cal as their healthcare provider, which means the people of California are carrying the freight on that healthcare cost. And we know our budget and our system is overburdened and underfunded. And so to have an opportunity to talk about some of these impacts are really important.
Healthcare is a foundation to everything, and I just, have to say our communities are struggling tremendously with everything, the uncertainty of it all. But healthcare is one of those issues that continues to be top of mind for families, and I know because if families are not able to go to work with good health, everything else falls apart. As an educator, I can share with you how many times we have students that have their teeth falling off, or they're really hurting one way or the other because their parents can't afford health care.
As you think about the threats that are currently in place to all of the advancements made under the Affordable Care Act, I like to categorize them in 3 areas. 1, HR 1, or the One Big Beautiful Bill. You're very familiar with that $900+ billion of cuts that will lead to vast losses in terms of Medi-Cal coverage and also coverage in the marketplaces. The Congressional Budget Office estimates $10 million. The other 2 are regulatory changes that are currently underway that we'll probably hear more from Covered California, that are seeking to make less valuable plans available through our marketplaces and elsewhere. And then there's just a broader effort currently to dismantle, remove federal funding that we have relied on, and it will lead to vast coverage losses.